Hello everyone, my name is Logan Corwin. I am a graduate student at Oklahoma State University College of Health Sciences, and I will be presenting the evaluation of adherence to reporting guidelines among geriatric journals, a meta-epidemiological study. Myself and my peers listed below completed this study, and a big thank you to OSU CHS research librarian John Goodell for his helping on the journal research. For our introduction, we realize the adoption of reporting guidelines in clinical trial registration reduces bias and improves transparency of research. The purpose of the study was to assess the submission guidelines of top geriatric and gerontology journals for their adherence to specific reporting guidelines and clinical trial registrations as mentioned in their editorial recommendations for authors. As for our methods, we identified the top 100 geriatric and gerontology journals via the 2021 Scopus SiteScore tool. Once we had established the top journals, we scoured each journal's instructions to authors for data regarding reporting guidelines and trial registration. We determined the amount of times clinical trial registration had been not mentioned, not required, recommended, or required, and for specific reporting guidelines, we determined if the guidelines were not mentioned, recommended, or required. We then represented these findings as a percentage of the top 100 journals. As for our results, the reporting guidelines we researched included Equator, Consort, Moose, Quorum, Prisma, ICMJE, Spirit, CoreQ, and Prisma P. As you can see from Figure 1, there is an inconsistency of the mentioning of reporting guidelines across the journals. And in Table 2, you can see the data of clinical trial registration and its inconsistencies as well. For our results, we concluded the use of common reporting guidelines in the top 100 geriatric and gerontology journals is inconsistent, while the mentioning of study registration was low overall. In summary, we would like to observe journal editors further recommend author guideline adherences to reduce potential bias among their published materials while also considering adoption to produce transparency. Thank you all for your time.